Dr. Sarabjit Singh, working as infertility specialist in Benson's Hospital, Ridge IVF. Now, this information is for those males who have just come to know that there is no enough sperms in their semen to produce a child. Or rather, I would say that those men who have been told that they have absolutely no sperm in their ejaculated sample. And the medical terminology that we use for these kind of patients is azoospermic patients or azoospermia. Now, what I would like to emphasize here is that azoospermia means that there is no sperm in the semen, but that does not necessarily mean that there is absolutely no sperm in his body or in his testes. There are various techniques that can be applied on these patients where there are chances that we can recover the sperms. The techniques like PISA, where we recover the sperm from the epididymis. Then there's this technique called TISA, where we try to extract the sperms from the testes, and these all are actually through the needles that we do. Even if we are not recovering the sperms through needles, we can even progress to the highest stage, that is TIS, and the latest one that is called micro-TIS, where we try to cut open the testes and try to recover the sperms from the seminiferous tubules. Now, obviously, that depends upon the pathology, and doctor generally comes to know after examination of the testis whether he'll be able to recover the sperms through the testis or not. But yes, there are chances that sperms can be retrieved in almost 30 to 40% of the cases on an average if testes have failed to produce the sperms. And if it's a case of obstructive azoospermia, where there is obstruction somewhere and the patient is not able to deliver out the sperms, then chances of retrieving the sperms from these patients is almost close to 80 to 90%. So what I want to tell you all is that if any of your patients, or even if you have been diagnosed with azoospermia or there's no sperm in your semen, please consult your doctor. And before opting for a donor program where you try to take sperm from some other male, please examine yourself, get few investigations done, and ask the doctor whether sperms can be extracted from your testes or not. And obviously, if sperms can be extracted from your testes, the procedure actually that will be done is IVF only. So, my best of luck to all azoospermic patients.